Disclaimer: this post features medical professionals sharing personal experiences and opinions. Content is for educational purposes only and does not constitute medical advice, diagnosis, or treatment. Views expressed are solely those of the individual guest and do not represent any hospital, institution, or regulatory body. Always consult your own physician for medical decisions. Thank you. I'm creating a new series, Chitchat, with one of my friends who are famous personalities and who are doing well in their careers. They may not be so old enough to be great. Still, they have achieved great in their paths. And I'll be starting the series. And today, my guest will be Dr. Adithya. To tell about Dr. Adithya, he's a pediatrician and he's one of the brightest minds I know. He's my UG batchmate, and he cracked his NEET PG in his first attempt and got into a prestigious college in Delhi. And today we'll have him. We'll ask him some questions and gain his knowledge so that all the viewers may gain some insights regarding the pediatric healthcare. And we'll dive into it. To speak about Aditya, I told he's the brightest mind. I've known him since UG. He's been more into academics. He's going into quizzes, and he used to stop the quizzes, and he used to be a very good friend, more welcoming. I never seen him be harsh to anyone, so I think that might push him to take pediatrics. I think so. We'll get to know from him. Hi, Aditya.
Hello, Dr. Adil. I think you are exaggerating a few things, but definitely your words mean a lot to me. Thanks a lot.
Like, Aditya, can you tell me about why did you get into pediatrics? Because we were there in UGs, going to postings, going to classes, sitting in the first row. Why did you go into pediatrics?
First of all, when I was in UG, I always used to, I never had any confusion about medicine or surgical field. I always wanted to do some medical field only, and that too, I wanted to get into clinicals. Okay. But the only confusion which I got was between pediatrics and medicine.
Okay.
But later, I felt that there was some pull of mine towards pediatrics. Like, I prefer to treat children more than adults, comparatively.
Okay.
So the reason for that was we often feel that pediatrics is nothing but little adults, but it's definitely not so.
Yeah,
and getting a child getting treated by me feels much more satisfied than when I treat the adult, because when we take a small decision that changes the whole life of, because they have a whole life ahead, which helps in changing their whole life completely. So becoming a part of it made it worthwhile, and that's why I chose pediatrics. Like, pediatrics is definitely worthwhile.
Yeah,
I don't think any other brand could provide that much of satisfaction.
Yeah, actually, there are only two of our batchmates who got into a specialty in their first attempt, like during the internship attempt. You were one of them. Like, you got a top 1,000 rank. Most of the people would have opt for radiology. So you chose pediatrics. That says you definitely had a flaming mentality to get into pediatrics and do something better in the future. Yeah, I can definitely see that. And I'm seeing your educational awareness videos coming into YouTube these days, and they are definitely worth watching. So, taking about, how was your residency? Like, how was your pediatric residency? What did you expect and get into pediatrics? Have you feeling the same after getting into pediatrics?
Like, what I felt was when I was in my UG in Tamil Nadu, like, the duty hours were too much, and even in internship we used to work a lot.
Yeah.
But I realized when I came to Delhi, I was my mindset was always to work hard, like, no matter what, I have to stay late at night, everything. But in Delhi, the college which I joined, it was so good. The work life was so good. But I don't think that it's the same in every other college. But most of the colleges in Delhi are like that only. The work life is good, and but it was a pediatric only hospital, due to which the caseload was immense. During the work timing will be very tough, but later we get post duty off and all. So that felt
that's a great thing. Getting a post duty off in residency is a great thing.
Yes, I never got even in internship. You to know that. Our internship was.
Like, post duty off, getting in your duty residency is a very great thing, and nobody gets it, to be honest. Can you tell me about your college? Like, what's your college?
I did my post graduation from CNBC, Chacha Nehru Bal Chikitsalaya, which is one of the most established hospital, which is exclusively for pediatrics. It contains all the pediatric super specialties and all. So at first I was like, am I joining the right college? Am I doing the right thing? But after I joined there only, I got to see millions of, like, lots of cases. I saw case varieties were so great. So I felt that I had chosen the right path, and I had chosen the right college. I definitely will not regret ever in my life.
Yeah, I've been seeing your statuses. Like since you joined, I've been seeing you doing a liver biopsy, doing a kidney biopsy, doing a bone marrow biopsy. I've seen you have a lot of hands-on and exposure.
Yeah, the exposure is so great.
Yeah. Tell me about like one case which changed your perspective towards pediatrics. Like this case, oh my God, I haven't expected this from pediatrics. This gave me another boost to continue this pathway. What's the one case?
Okay, should I start with a bad one or a good one?
Like for according to me, there is no bad case in like in a
Like
medicine
bad
field,
case in the
because if
sense,
one bad case can turn into 100 good case later. So I think you can start with a bad case which enriched your knowledge and made you
yeah,
want to do
definitely.
better. Yeah.
Actually, it's kind of a sad story. Like, I just, even now I feel I could have known much more than what I know now. So it was my second or third month of residency.
Okay.
So what happened was, there was a child who was around 2 to 3 year old, and he was a case of typhoid, and blood culture came out to be typhoid positive.
Okay.
But there was one thing which the child was complaining was severe abdominal pain. So we all were thinking what could be the cause. Like, enteric fever has abdominal pain, that is very common. Okay, so what we did was, at that time ultrasound, the radiologist was on leave, due to which we had to do CT for the child, because the pain was severe.
Okay.
Child was suffering from pain. Later we found that the child had developed pneumoperitoneum.
Okay. Was that a appendicular perforation or a
No,
ileal
it was like,
perforation?
no, like he developed pneumoperitoneum because of, probably because of some typhoid ulcers which could have ruptured or anything like that.
Okay. Okay.
So that could be that was a cause of pain. So what we did was, we did a pediatric surgery call, and then pediatric surgeons were like, we can't do anything unless it is ultrasound guided. So, but we did not emphasize much on that. We told, okay, let the radiologist come. We will get the treatment done. So what happened was, and after that, I got shifted over to my PICU postings next for the next month. So what happened was, that child came in a very sick state, and at that time the pediatric surgeons were ready to put that is they were the intra-abdominal drain they were ready to put, and at that time they did not require any ultrasound guided probe. So what I felt was, had I known about this much earlier, I could have emphasized them more, like, please do it, please consider doing this. I could have emphasized it, because at that time I did not have much knowledge that how deadly a pneumoperitoneum could be. So even now I feel that I could have known more, I could have emphasized more, like I could have done something which could have saved the child's
Change.
life.
Yeah.
Ultimately,
Definitely.
the child died.
Yeah.
So even now I regret, like, not knowing much about it. But
Yeah.
after that, that made me think that I had to take the right decision, and I had to take timely decision. More than the right decision,
Yes.
it is always timely decision which will help in saving the life. And after that, I always try not to miss out anything like this, and to emphasize even small things. I try to overemphasize it, so that I do not miss out on anything. So
Yeah.
that's changed my life completely.
Yeah. I can see how good a doctor you are. I can see how sad you feel regarding the one wrong decision you took in your
Definitely,
early
I
days of
feel very
residency.
sad.
Yeah, I can also correlate with these things that happen in the early days of residency, because you are new, you don't know much. But once you get into residency, like 1 or 2 year passed away, you just think about your decisions. Oh, I could have taken that
Yeah,
decision earlier.
definitely.
Yeah, that
That,
definitely
that
happens
was
in
a
residency.
learning lesson for me, and
Yeah.
I definitely will not miss out, and I will try to emphasize more after that incident. I definitely have tried to emphasize more.
Yeah, I'm really
This
happy, and
was a
I'll
learning
be
lesson for me.
proud in the future to see you grow more heights and become one of the famous pediatricians
Thank
in
you so
India.
much.
Yeah, it will definitely happen. I can see it from the way you express yourself on a bad case. Okay, Aditya. So, like pediatrics, we know it's not just children. It starts from the day the child is out. Like it starts from the initial resuscitation part. The pediatrician job starts. Can you tell me
Definitely.
what does a pediatrician do? Like once the baby is delivered by the physician, what does the pediatrician do? What from where does the job of a pediatrician starts?
Actually, the a great thing about pediatrics is that most of the things we just have to give supportive treatment to the child. Supportive treatment helps in bringing the best in child always.
Yeah,
So
I think
whenever the child is born,
support is very necessary even for adults also.
yeah,
Like the
definitely,
support
yeah.
is very
So
much
what
necessary.
happens? Yeah. So what happens is that whenever the child is coming out, so one thing we have to see whether the child is crying. If the child is crying, that means the next part is totally easy for us. There is nothing we have to do. We just have to give them supportive care, like provide them warmth and drying the baby, and then just provide skin to skin contact, so that it's always a mother's job much more than us, which we have to do, like providing them breast milk. Breast milk will help in curing almost all diseases.
Yeah, definitely. Okay, this is a regular thing. Can you tell me a kind of a weird experience, or like the experience that got you into palpitations when you went for your resuscitation?
Yeah, definitely. I have lots of things.
Yeah.
So
Can you
what
share
happened
anyone?
was, like, it's always a nightmare whenever the child is not crying.
Yeah.
It's definitely a nightmare.
Yeah, definitely.
Like we will be surrounded by all the physicians, and we'll be surrounded by the parents, attenders. Everybody will be surrounding us, and we will be like the player in the field.
Yeah.
And they all will be watching us, like they will be judging us whether we are doing the right thing. So I will be like, we have to, but the first thing we have to do is we have to be calm during that moment.
Yeah,
No
sure.
matter what, I am the player. I know how to play. I know how to play. I know how to do things. So it is me who knows, who have the knowledge to do that. So I don't mind about anyone. So at first I used to get palpitation a lot, but after that I became calm, and I started tackling lots of situations like that. So when a child is not crying, we give something called like we have lots of steps in Neonatal Resuscitation program. So whenever the child is not crying, that becomes a nightmare for us. But it's not like every child who is not crying will have lots of complications. It's never like that. If we take the decision at the right time, definitely the child will come out to be just fine.
Yeah, I can understand the situation, because in internship, when I didn't have even a responsibility, being an intern, doing the suction in the initial neonatal resuscitation give me chills.
Definitely.
Yeah, but when as a responsible junior resident doing that, definitely it would cause palpitations to you. Okay, like I want to know. So a few things the parents do once the baby is out, like giving honey to the child, or giving a sugary syrup to the child, or giving something that's given by religious preachers. Like, do you support these things, Aditya? Is that the right way to give something once the baby is out, other than breast milk?
Like I would like to emphasize this one whole sentence, which was repeated time again in my residency, is breast milk is the best milk.
Yeah,
always.
sure.
Okay.
Yes.
So that's what, any other thing apart from breast milk is definitely not recommended.
Okay.
And there is something called guttika pani, which we use, which is used in North India. Guttika pani is nothing but some herbal medication or something like that,
Okay.
which I have never even seen, but I have heard a lot. They are
Okay.
like, they keep asking whether we can give guttika pani. It's definitely not recommended. And honey less than 1 year is definitely not recommended, because it can cause something in a child called as botulism. It
Okay.
can affect the nervous system, due to which the child can ultimately even die because of that.
Okay.
So
The child may
definitely
get
honey is not
paralyzed.
recommended.
Child may get
Yeah,
paralyzed.
totally paralyzed. He can get paralyzed. So he may not able to suck. He may not able to do his normal activities. So
Okay.
it can even result in long-term neurological complications.
Yeah. Because these
So
parents must know, because they usually bring the statement that we've given to you, we've seen like 1,000 people having this, nothing has happened to them. Like, how do you
yes.
defend such things when you are in OPD? Like, parents come to you, they tell, we have given this, nothing happened to our children. Like, how do you defend these things, Aditya?
Like the most of the things, what helps is that if we give, most of the time, according to my experience, if we start giving them negative, like negative things, if we tell that no, a child will not be able to handle this, the child will ultimately have this much complication, they understand that better, much more than we give positive things.
Okay.
So if we give the negative things, they start getting freaked out and they stop doing that thing. So according to my experience, I felt that telling them like what could happen because of that was much more important than what will not happen because of that.
Okay.
Like
Okay.
telling them like what could happen, giving this can cause this. If we tell them like that, they will definitely try to understand that.
Yeah, because pediatric OPD is nothing but there is a single patient. Actually, you treat three people, to be more precise.
Yeah,
The
definitely.
child, the father,
That's
the mother, sometimes a nanny might also join them. That's the most
definitely,
difficult part in the
definitely.
pediatric OPD.
Yes,
Okay,
definitely.
like this is the initial neonatal stage. Okay, next going to the infant stage. Yeah, I see more
Okay.
children nowadays. More they are addicted to their cell phones. They have more screen time. what's the problem going on with this? Is because of lot of watching the mobile phone is the mistake, or it's a parent's mistake? Because the tantrums the children throw, they couldn't control them
Yeah.
mentally, because a new parent can't control their tantrums, so they give their mobile phone. How do you see as a pediatrician? Is this a big
Um,
mistake? Is there anything to avoid? Is there anything to change in this thing?
Actually, I feel that the newer generations, the upcoming generations, are not being brought up properly as the previous generations were brought up.
Yeah, I think this might
So
be a
I
bit
feel
broad term, like they are not brought up properly. I think you can be
brought up
more.
in the sense,
Yeah.
yeah. What I mean is they are getting exposed to every technology in their early life itself, which I
Yeah.
don't think is the right thing for the baby. And like here, I would like to emphasize a very important fact which has been recommended by Indian Academy of Pediatrics.
Okay.
That is that they had that is less than 2 year old child. That is the child is up till 2 years of age. Screen time should be totally absent. Like there should not be any screen time.
Okay.
That's what the Indian Academy of Pediatrics recommends. And between 2 to 5 years of age, it recommends less than 1 hour per day. But do we see any kid like that?
No, I see kids playing these games like Subway Surfers a
Definitely.
full day. They're just crying. They just have their
That
phones in
totally
their
not
hand.
recommended. Like always, it's a like we have to nip in the bud. We have always heard of that. Like
Yeah.
so, when we expose the child to these things in the earliest stage itself, it can predispose the child to several lots of complications in the eyes. They can get obese. They can get heart complications.
I think the
In the
most important thing is the
definitely,
mental
yeah,
issues like autistic
and
spectrum
yeah,
disorder.
their cognitive ability will decline, and
Yeah.
their like, brain growth will get affected. There are lots of things which are harmful because of lots of screen time. So that's what
Okay.
I would recommend.
Yeah. Like, what other things can the parents do? Like, when a child is throwing a tantrum, like, if there is a car and she needs to take that, if something that is more interesting for the child and it needs to get that, it shows tantrum, it cries, keeps crying. How can a parent console the children? What can they do other than giving their mobile phones in their hands?
See, first of all, tantrums are very common in kids. It's like their own way of showing that they need something.
Yes.
Okay. So whenever the child is throwing tantrums, the first thing which the parent should not do is not to get apprehensive. They should not
Okay.
get apprehensive. The first thing they have to do is that they have to first calm themselves. They have to first calm themselves. Okay, it is normal. It is nothing to worry. And they have to try to distract the child in a better way. Like they can change the topic to something else, and they can distract the child by giving them something else apart from the screen time. So that's
Okay.
that distraction is a very major role, and they should not always encourage a child like if they want something, they should not encourage the child to give that because that becomes a very bad habit. Even later life, they will feel that whenever they are crying, they will get encouraged and they will get what they want.
Okay. It's
That
like
should not
it's like
definitely
it's
be
kind of
encouraged.
our physiological experiment, the Pavlov's, like
Yeah,
when the bell is
definitely.
rang, it starts, the gastric
Yeah.
secretion starts. Okay, like
Yeah.
what would
Exactly.
you prefer to be an alternative to mobile phones? Like, for example, like you are married right now, future you'll have a child.
Okay.
What would you give to your
Yeah.
child when it cries?
Like I can give some simple ball games could be tried, and I can even like some homemade activities can be done. We can advise them to do painting, and we can advise them to do some images or some maze, like they can follow an object, and they can play with the ball. Anything which helps and distract away from the screen is definitely a great thing.
Getting. Okay, right. Yeah, this is one of the most common. The screen time among children is like
Definitely.
they are
It's like
spending
it's a
more
very
than an
big
adult.
topic. It's a very big topic.
Yeah, it's a very big topic. I think we can't decode everything about the topic. Okay, next
Definitely.
came to the infant. Just we'll move to the next phase of the pediatric
Yeah.
childhood. Okay, once the patient becomes infant after 1 year, I can see nowadays I see most children are so lanky. They are not even lean. They are lanky. Even they come from a good household, they seem more lean and they don't have a proper growth, and they are always short. Even though I don't think genetics starts at this much young age, they must have some growth for their age at least. Like, what do you tell to the parents, how can they enrich the child's nutrition? Like the nutrition is the most important part, because even educated household, they don't provide the children with proper amount of fats and protein for required for their growth. Can you just give me your insights regarding this nutritional thing?
First of all, I would like to emphasize the importance of starting complementary feeding. So complementary feeding is something like always it is recommended that in the first 6 months of life, the child should be exclusively breastfed. Not even water should be given, because it is breast milk which covers everything which the child needs.
Yeah, the same
But
you
beyond
told.
6 months,
Breast milk is the best
yeah,
milk. Yeah.
yeah, beyond 6 months, that is always after, like at or beyond 180 days of life, typically, like not more than 180 days, not less than 180 days. Exactly at 180 days of life, we have to start something called complementary feeding, where we will start top feeds, like in the form of initially mashed fruits, vegetables, dal, and all we can start, and gradually we will improve we will increase the consistency. Initially in puree form, gradually we'll increase the consistency, and we will increase the frequency of this complementary feeding. Like what I have seen parents doing is that the child gets used to breast milk, due to which they start giving milk every time the child cries. They start giving milk, due to which the beyond 6 months breast milk it only is not sufficient enough to supplement their needs.
Okay.
So we need complementary feeding, which is definitely needed, which the nowadays parents are just trying to fulfill their duties by giving just breast milk and nothing else. That is
Okay.
definitely not indicated.
Okay.
And many parents I see, they start giving cow milk beyond 6 months. Actually, cow milk is definitely not recommended less than 1 year of age, because cow milk will interfere with like they do not give proper adequate nutrition as compared to breast milk. So definitely cow milk is definitely not indicated
Yeah.
less than 1 year of age, and even sometimes less than 2 years of age, they say. And so that's the one thing. And how we can improve the nutrition of the child is by giving them like there is nothing new to be done, nothing costly can be brought like they need not buy anything costly. Even the homemade things can be done, like they can give suji ka halwa, and then they can give moong dal. Like
Moong dal.
not giving dal water is definitely not recommended. They can give
Here,
dal.
I want to interfere in this point.
Yeah.
I've seen people give biscuits mixed with milk. What's your opinion regarding that thing?
Actually, they can give. It's a good thing only. Like I won't say it's not recommended. They can give, but they should not just. They should not only give that.
No,
Like,
is it really a good thing? Because biscuits these days are nothing but a crap. They don't have anything
yeah,
nutritional. Is it okay if we give a biscuit mixed with water? Like I've seen people
like
giving marigold mixed with water as a feed to their children. Is it
I
acceptable?
won't say it's totally not recommended. I will give 2.5 stars for that.
Okay,
Out
out
of
of
5 stars.
10, maybe out of 100.
Yeah. Okay.
It's not
Okay. Out
advised by
of 10, I
you,
will
but
give
still,
2.5 stars.
if they wish to give against your doctor's advice, it's okay, right?
Yeah, they can give, but there are lots of things available in their home.
Yeah,
Why should they
yeah.
go for
Yeah,
outside
I've
things?
seen people
They
giving
have
this.
lots of dry fruits, and they can
Yeah.
make a mixture of it. They can give a powder, like they can make a powder out of it, and they can mix it with milk and all.
Okay.
So there are lots of home options
Home
which
options.
are available, which can be used by them.
Used by them.
And always what we recommend for weight gain is that we can add little amount of ghee to every feeds, so that it helps in improving their weight gain. And parents should not worry about their height, weight, unless and until it follows at normal growth trajectory.
Okay.
And always you have to monitor with the help of a growth chart. They have to monitor it during every vaccination visit. They have to get it done, so that they will get to know the growth trajectory, and any step can be taken if there is any deviation from the trajectory.
Okay, sure. But like they should not decide by seeing other children, that children has grown well, mine hasn't grown.
Not.
That should not be there, right? They should be
definitely, because
focused
every
on
child
the
has its
trajectory.
own genetic potential is there.
Yeah,
because
okay.
they won't grow, and they won't grow taller if their genetic potential is not there.
Okay, right. Yeah, I understand this. Okay, this is a bit of a kind of sensitive question, not a sensitive one. Like as adults, there are vegetarian adults, non-vegetarian adults are there.
Okay.
So what's the right time to introduce a veg protein source to a children and a non-veg protein source to a children? What is the right time to introduce it to the children?
Veg protein source,
like
we
paneer,
can start.
chickpeas.
We can start even beyond 6 months of age. We can start veg protein source, and based on non-veg protein source, I consider an example of meat.
Okay.
It is recommended that we can start meat beyond 9 months of it. We can start giving meat.
9 months. Okay.
Definitely, it's like we can give.
Okay.
And one more thing I would like to emphasize one thing that these days we see lots of like dates syrup which is mixed in the milk.
Okay.
I would totally go against it because always when we give iron with calcium, there is totally no absorption. Definitely, any iron containing syrup, if it mixed with milk or anything calcium containing, that is definitely not worth it. It is better you not give such things.
Yeah.
You
Right.
give either dates alone, you give milk alone, you can give, but never mix it completely. I will have to emphasize that fact time and again. Please don't do that.
Yeah, definitely. It's a very great insight from you. Okay, then once we're done with the nutrition part, I want to know more about vaccines. Like I've seen people showing hatred towards vaccine. Not all. There are a few people I've seen. They're like, you people give vaccines
In
because of
Delhi, there are more.
pharmaceutical companies. Why are you giving vaccines? Vaccines are not required. Did our grandparents use vaccines? I've heard these kind of questions a lot. Like, even I'm not a pediatrician, I've seen children in my families and their parents asking me such questions like, why are we giving vaccines? It does vaccines are required. It is a pharmaceutical thing. Babies get this kind of side effects, this side effects. What do you want to say to those parents from a pediatrician's perspective?
One
What
question
kind of
I would like to
cases you
ask
see?
the parents.
Yeah, sure.
One question I want to ask the parents: do you really think that government is fool enough to invest in such an important thing called vaccine if it is not useful for the child? Do you really think that government will invest millions of rupees on vaccines if it is not useful for the if it is not being used by the child? Definitely it's not like that. Government always thinks that child requires the right thing at the right time. That's why vaccine should be given. We have to always think that government is not investing just simply. They are investing because they want the child's life to be better. So that's why vaccines are always recommended. Always ask this question: is the government simply investing in this
Yeah.
millions and millions of rupees? It's definitely not so.
Yeah, because you might have seen more patients who didn't take vaccines in their right time at their young age, and they're suffering from some kind of disease which should
Definitely,
be eradicated. Like those diseases which no one, even an enemy, prefers not to come to them. You might have seen cases who just haven't taken vaccines at their young
definitely,
age,
yeah.
right?
And I would like to emphasize on few important facts as to what vaccines can prevent us against deadly diseases like.
Okay.
So they help in preventing us against polio, which was a deadly killer disease in the past, and even now we can see lots of people having the sequelae of that. Sequelae is nothing but any complication which has occurred in the past because of which they are still suffering. We have
Okay.
seen so that vaccine helps in preventing us against polio. It also helps in protecting us against rotavirus, which causes severe diarrhea, which can even kill the child. It
Yeah.
helps in protecting against such a deadly disease called rotavirus, and it also helps in providing protection against diphtheria, pertussis, tetanus, which can cause lots of diseases in a child. And it also helps in preventing against measles, rubella, which are deadly viral infections.
Yes.
So, like government is not just investing in it simply because they want the child to get the vaccine at the right time so that they do not suffer later. And there are lots of newer vaccines also like pneumococcal conjugate vaccine, meningococcal vaccine. There are lots of vaccines like that. Everything is recommended. Please never consider that vaccines are totally not recommended. And the older people did not had because they did not have that much facility. So now you have
Yes.
free. They have your facility. It is available free of cost. So please consider getting your child vaccinated, no matter what.
Yeah, because I've seen news like people like neonates and infants die because they had diarrhea. Like that's the
Yeah,
kind of
definitely.
thing that
Diarrhea is
happens,
a
but
killer
still
disease.
people just avoid vaccines. There are people still, I think even in metro cities, there might be people with this kind of ideology like vaccines are bad, not to take. Even after this video gets published, many of them may comment below this: these vaccines are a pharmaceutical thing, you haven't known this, polio has brought by this. We might see those comments
Maybe there
below
could
this
be
video.
one reason why they might be afraid of it is because sometimes parents feel that after giving vaccines, their child is developing fever, the child is getting sick. Like always remember that whenever we give some medication, whenever we give some vaccines, especially, their immunity get triggers. So it
Okay.
triggers their immunity, due to which these responses like fever and all is supposed to happen. that only indicates that the child is actually responding to the vaccine. The child is actually developing some immunity to it. So always never get afraid of a mild fever. If it is high grade fever, you can definitely consider your pediatrician. But if it is a mild fever, you should never consider that to be harmful thing, like it is happening because of vaccine. It is actually a good thing which is happening.
Okay.
It's actually triggering their immunity.
Okay, Aditya. Like now we're going to get into another biggest thing that needs to be discussed here. Initially, we can see grannies educating their grandchildren regarding the age-old, like mythology kind of practices they do. Now, what's the problem with this is due to the widespread social media and active social media users, those activities which have been within the family has now reached a wide range of audience. You can see that because I'm seeing videos. I've seen videos. People used to add something, give to the children. The children might get great. It was initially belonged to the household because there was a family, a granny, just passing it to their grandchildren. But in this point of time, it's being widely available through. I'm not mentioning about the platform. It is widely available through the platform through videos.
Definitely.
Yeah, you can just bust some of these practices which should not be followed by the parents.
Okay. First of all, I would like to emphasize that in the previous age-old days, there was nothing called evidence-based medicine.
Yes.
These days, it is always evidence-based medicine. We have evidences for everything. Lots of researches have been done in whatever we are following. It is always a scientific reason. It's much more greater than non-scientific one, right?
Okay.
So always we prefer scientific one. So most of the practices, age-old practices, like applying cow dung, starting from when the child was born, applying cow dung to the umbilical cord. Definitely, it is definitely not recommended. There are lots of other practices when the child grows, like they start applying oil to their ear, oil to their nose, and all. That is definitely not recommended because if the oil gets into the lungs, it can cause pneumonia. It is called aspiration pneumonia, and if it gets into the ear, it can cause infection. And I'm against the practice of using kajal for the eyes, which they use. Kajal usage is definitely not recommended because kajal can trigger some kind of inflammatory reaction. It can cause infection in their eyes, and it can also cause blockage of their that is tear ducts and all. So that's why it is definitely not recommended. Like without kajal, also child looks just cute and fine. Right? Why should we use kajal for that?
Yeah, definitely. Yeah, because nowadays the widespread misinformation throughout in social media is getting so caught up nowadays. Because even I can take this bottle and tell this contains elixir which can cure every diseases. Please buy at this website. It becomes famous.
Yeah, definitely.
Yeah, definitely. Okay. Now coming to some grown-up children. Okay.
Yeah, definitely.
What's your take on this hygiene hypothesis? Like we would have been read in our books when we are reading like immunity, people go out, play in the sands. Like even in my childhood, I went to play outside cricket. I used to take the ball directly from the gutter and I just used to wash the hands even without soap. And we are traveling. Nowadays, the children, you might see there are a lot of cases among the children, people having atopy, allergic conditions are more. Do you think really in your perspective in the OPD whether there is a relation between this hygiene hypothesis thing and the patients you meet in every day?
Okay, first of all, I would like to tell what hygiene hypothesis is to all the like subscribers who are watching it.
And another one thing, I need to add another question. Is it advisable by you to let the children play outside freely, to go out, play free, not sitting in the floor, in their marble floor or some floor in their home and just playing with toys, going out to the environment and playing with the nature? What's your take on this?
Definitely. Yeah. See, that's the thing which is very much lesser in these days because everybody is involved in just screen and studying at home. Even homework is too much because of which they are not even able to concentrate on going outside. The school has become so tough these days. So first of all, hygiene hypothesis. Hygiene hypothesis, like
meeting got cancelled in the middle.
Yeah.
Okay, you can just tell me about hygiene hypothesis now.
So first of all, hygiene hypothesis basically means that any reduced exposure to any microorganisms in the early life So what happens is that it will lead to an undertraining of immune system. That is, the immune system is getting less trained for that, and which will increase the risk of allergic diseases like asthma and allergic rhinitis in the later life. So that's
Okay.
what hygiene hypothesis states.
Yeah, yeah.
So and as you were telling that we should be exposed to as much things as possible. I'm not saying deadly things. Like
Okay.
we can expose the child to the natural environment. We can allow them to play. We can allow them to play in the mud and all. Because
Okay.
only then their immune system will get triggered, and only then they'll be able to not suffer from all these diseases. Because we have seen even our grandparents who are living even now, because they have been exposed to lots of things, that their immune system has become like amazing.
Amazing.
We can't even touch that now.
Yeah, definitely. Sure, but they should be more careful when their children have some injuries. Those should not let them play in,
Yeah,
but
yeah,
like,
they have to be
yeah.
careful. They have to apply. They have to apply. But it's not like we should not allow them just because they will get injured, and not allowing them just because they will get exposed. That is wrong.
Okay.
Allow them, expose them. When they get exposed, if we need to treat, we pediatrician are always there to help you out.
Yeah, definitely, definitely. Aditya. Okay, next we'll get into something interesting. Okay. Not interesting. Now we'll get into some emergency topic, like pediatric emergency
Oh,
topic.
okay.
So, what are some signs? Like, there will be some warning signs to be more precise
Okay.
in pediatrics because we used to see this everywhere in every disease. So, what are some of the warning signs the parents should never miss?
Okay.
Never miss. If
Okay.
this comes, they should never think twice. They should reach the pediatrician at the most possible and the fastest way. Can you share me
Okay.
some emergency
Yeah.
signs?
Like child is getting lethargic. Child
Okay,
is
I
not
think
feeding well.
you can just
No.
explain the term lethargic because most of the people here
Okay.
might not
Lethargic
understand the
means
term.
the child was previously responding to some stimulus, but now the child is not responding
Okay,
as he used to do. Like
okay,
previously, he used to respond. He was very active, but currently the child is not that much active. He's not responding to the same stimulus which was given earlier. He's not responding. So
okay,
that is a danger sign. And if the child is taking fast breathing, like you can see that there will be lots of gaps in his chest. Like in the chest, there will be, you will see lots of gaps. He's trying to breathe with difficulty.
okay. Like
That
we
is
can
definitely,
visibly see the ribs of the child when it's breathing.
yeah,
Like
yeah, yeah,
it.
definitely,
Okay, yeah, I understand.
yeah,
Okay,
yeah. If the child is throwing seizures,
okay,
that also is a very important danger sign. And if the child is having persistent vomiting, and at any time any greenish or yellowish vomiting, is definitely a danger sign, because that indicates most of it surgical cause than medical
yeah,
cause,
yeah. I
which
understand.
you
There
know
might be
better than
some
me.
obstruction, intestinal
Yeah,
obstruction.
yeah, yeah, definitely.
There might be malnutrition, something. Okay, that's good.
So
Emergency, considering
finally,
emergency,
I would
these are
like to
things.
emphasize once again,
Okay,
lethargy, and when the child is breathing very fast, the child is anytime unresponsive, or if the child is having persistent vomiting or any greenish or yellowish vomiting, which is called as bilious in medical terms,
okay.
and anytime the child is throwing seizures, these and all are the very important danger signs which you can easily see at home, and you can easily, yeah, that you have to rush immediately.
Okay, like till now, I think we have seen most important awareness points from you, and I've just extracted as many as important points. Okay, next,
Hope it reaches the
next
right
we'll get to
population at the right time.
know how a pediatrician functions. Okay, like you've been a adult doctor during your internship. Like you spent
Yeah.
most of the time being adult doctor
Okay.
because 1 month was our in pediatrics posting. Remaining were like mostly adult medicine, may be it a
Yeah,
surgery or
yeah,
be it a
yeah.
medicine.
Yeah,
Anything.
definitely.
So now for the past 3 years, you've been treating only pediatric patients.
Yeah,
You
yeah, yeah.
haven't met adult patients unless they are your
Yeah,
OJR or your professors. They might be the most adults you've met for past
yeah.
3 years. Okay, how it is different handling an adult patient and a pediatric patient? Like we previously discussed, pediatrics is not a single patient. Like when a child comes, it's
Yeah,
not
yeah,
only
yeah.
the child, it's their
Definitely.
parents, everybody.
Yeah,
So how it differs? How it differs in giving more advice to the patient? How will you advise the patient? Because it's not about the patient, it's about the family together.
oh, yeah, definitely.
Share me.
So, like one myth which I would like to clear out is that pediatrics is just medicine in little adults. That's a myth. That is definitely not the right thing to say, because everything is totally different in pediatrics. And in pediatrics, emotions play a major role. Like we have to be more like emotions play a major role in the sense parents are emotionally concerned and their relatives are emotionally concerned. So everything is emotional. So we should never feel that their queries are insignificant. Always we have to consider that every query of them is significant, and we have to convince them, and we have to give reassurance. Reassurance. That is the major
Yeah,
treatment in pediatrics.
this is a very important term. Reassurance is a term like broadly I've seen. It's not
Definitely,
only
like
important
that's
in
the most
pediatrics,
important in this video.
it's
Reassurance is the
important
most
in
important thing.
medicine. Reassurance is the
Yeah,
important thing. As a doctor, you can
definitely.
provide to the patient.
Yeah,
Okay.
like most of the
Uh,
times,
yeah, tell me.
parents just overemphasize whatever their child has. But even sometimes, because of Google and all, they even underemphasize some things, which is that
Yes.
is also wrong, and overemphasizing is also wrong.
Yeah.
Like always, when in doubt, consult the pediatrician. Pediatrician knows his job better because he has studied that for 3 years, right? So he
Yeah.
definitely knows something much more than you, right?
Yeah, definitely. Like, you have any one thing to share with the upcoming pediatric aspirants, like now pediatric junior residents? You want to share something
Okay.
with them, not academically. I don't want to know about how to
Okay. Huh, yeah,
study
yeah.
because these it's
Okay.
widespread. It's available everywhere.
Yeah,
You can find it
definitely.
anywhere. Like
Definitely.
anything to become a better pediatrician, not to become a topper, because being a topper is
Okay.
not a
Yeah,
big
yeah,
deal.
yeah.
If you put extra 2 years effort and prepare, anyone can become a topper. So
Okay.
the core that is missing nowadays, I feel, the
Yeah, yeah, yeah.
empathy part of being a doctor,
Yeah,
it's
yeah. Definitely,
being missed.
definitely. I'm just
I think
coming to it. Yeah,
it's
yeah, yeah.
it's not being missed, it's being forced to miss. Like we were
Yeah,
forced by the surroundings
definitely,
so that we
definitely.
miss the empathy part and get into something we have not expected to be. Because since the day we started MBBS, we were like, I'll
Yeah,
have to serve the patients, I have to
yeah, yeah, yeah,
see
yeah,
this.
yeah.
Because at this point of time in society, we've been forced to get into a role which we never wanted to play, honestly.
Mm-hmm.
So, what will be your one advice you'll give to your upcoming juniors, like it to follow so that they can become a better pediatrician? Like now, you may
Okay.
not have a much more experience in pediatrics. There are much
Mm-hmm.
more big legends in pediatrics, but at this
Okay.
point of time, you are a senior most because you have your third year JR, second year JRs, first year
Yeah,
JR,
yeah, yeah.
people in MBBS. You're a pretty senior to them. So, what one
Definitely.
advice you'll give to them to become a better pediatrician?
Okay. Like, I would like to tell them about my advice uh, by telling one great example, like which was very much heartwarming for me. So it was a case. I would like to tell a case to them.
Yeah,
So
sure.
it was a case of a 6-year-old child. So what like he was a typical case of like TB is very common in India. So what happened was he came with the complaints of fever since 1 month, and when he came to me, he was totally like paralyzed from one side, and
Okay.
he was having difficulty in chewing foods. He was having like drooling of saliva and all everything. He was totally like non-functional.
Yeah.
He required everything he needed his parent support. So what we did was we took the right decision at the right time. We started the child on antitubercular therapy. Along with it, we gave him supportive care. Like the child came out to be so well, but he had a prolonged stay in hospital. He came out to be so well that while he was getting discharged, I was on leave that day, and when I was on OPD, so he came to me one day. Then I when I saw him, I was like totally amazed. Like the child came to me walking. He was literally dancing on in OPD. He gave me sweets. Thank you, doctor, for saving my life. Like, that is the thing with pediatric teachers is like we always feel that miracles don't happen. Miracles do happen. Like doing miracles is all about pediatrics. Pediatrics is all
Yeah.
about doing miracles.
Yeah.
Okay,
This.
so always remember that residency is always the hardest part. Always it will be very hard, and you have to survive a lot. I won't say that it will be easy. It will definitely be tough, but always consider that like by making your by one small decision, you are changing the entire life of the patient. You are, especially in the
Definitely.
pediatrics, that plays a very important role. So it is always worthwhile when you see that I changed the life of this child, and that child is coming to me happily. So that child face, so definitely you will feel that whatever you have gone through, that night shift with a sleepless night, everything was definitely worth it. So always remember that what you are doing will help in changing the life of the patient, which I don't think any other branch offers.
Yeah,
Like
sure.
because they're
Yeah,
just starting their
definitely.
life, right?
Yeah.
Changing their whole life, making a biggest being a biggest part of it. Definitely, it's worthwhile. So uh, always take whatever you have interest in. And pediatrics is definitely a great branch. And always residency is a tougher part, but you always see in the long run, whenever you see any kid coming to you, he will always be cheerful. He will always be thankful to you. Always remember that because of you, a child's life has got improved and he is living a
Definitely.
better life. So that's what you have to keep thinking. And in residency, the major part which we lack is counseling part, which we are
Yeah.
not taught, which we have to learn by ourselves. Counseling is a major part in pediatrics than any other branch, because counseling plays a very important role. Because like whenever parent is having any problem, if we just say no, no, ma'am, nothing will happen. That nothing will happen. That word itself will give them lots of
Hope.
hope, and they will
Yeah.
start believing in you. They will start trusting you, and that's a major thing which we lack in residency, which has to be taught to ourselves. Like we have to teach ourselves like by us we have to teach ourselves that
Yeah,
by
sure.
our own.
Because even as a surgeon, for me, the first doctor I remember is a pediatrician. No one else. Like, I don't even remember the physician because I was still in the uterus because I couldn't remember. Like, pediatricians are so close to heart, even for many doctors. Like, it should be a proud thing because you are in the
Definitely.
fraternity of
Yeah,
pediatrics today. And definitely, uh, no one can like explain the fact. How does it feel? Because
yeah, yeah,
as
yeah.
a pediatrician, you play a very important role in human beings. Like, to tell, to be more precise, if a child, you are playing a main role in a child's
Yeah,
life. Like, if you treat a diarrhea,
yeah.
it's a big part. Because child today dies because of diarrhea. Children today die because of diarrhea, because of dehydration.
Yeah,
Like,
definitely.
even you're helping those patients in a young age, they might become scientists in the future. It's like a
Definitely.
teacher
Yeah.
who never who never wants their students to stop at school. They want to grow them bigger. They want to see them bigger. It's kind of pediatrician also. I feel like they're more close to a teacher kind of thing. Yeah, I'm so happy and
Like I
glad you
think a
are.
teacher is a greater profession.
Yeah, yeah. Teacher is definitely greater profession
Teachers
than
are
anyone
always the
else.
best.
Like, I'm just comparing their same thing.
Yeah,
Like,
yeah, yeah.
yeah, it's very. I'm
Like how
glad
a small
you went into
decision will
pediatrics.
change their entire life. That's the
Yeah, yeah,
best
yeah.
thing in pediatrics.
Okay. Now we'll get into something more interesting. Okay, it will be a
Yeah,
kind
yeah.
of rapid fire
The
round.
whole
Okay.
thing is interesting. The whole every part is interesting. There
Yeah,
is
this is actually
nothing which is less
my.
interesting.
Yeah, this is my first time. Like, I'm be trying this thing. Okay.
Okay.
Now we'll get into the rapid fire round. Okay.
Oh wow.
Yeah,
Most
we'll get a
favorite
rapid.
round of
Yeah, we'll
mine.
get a rapid fire round. Okay.
Okay.
Breastfeeding versus formula.
Once again, I repeat, breast milk is the best milk.
Okay, then. Antibiotics in children. Whether we should start it early or we should wait and start as per the requirement.
As per the requirement, definitely.
Yeah.
We should not start abruptly and always
Okay.
consult a pediatrician. Pediatrician knows the best.
Yeah, sure. Next, Google versus doctor.
Uh, Google informs and doctor decides.
Yes, sure. Vaccines optional or it is essential?
Like essential vaccines are definitely essential. Optional vaccine will provide extra support, extra protection is definitely needed.
Okay.
So I will recommend that also.
But overall, vaccines are essential. That's your take.
Vaccines are
Yeah,
essential. Yeah, yeah, definitely.
definitely. Okay. Now we'll bust some myths through a rapid fire. Cold weather causes cold.
No, it's a myth. It is actually viruses which causes cold. It is
Cold.
not the weather by itself causes cold.
Okay. Uh, all fevers need antibiotics.
No, that's not true. Like it depends upon the condition, and pediatrician knows the best. I will tell again.
Okay.
They know when to treat and when not to treat. They know it better.
Okay.
So whenever in doubt, consult a pediatrician.
Okay. Sure. Done. And ORS we buy from shops in the kind of cartons. It is the
Yeah.
real ORS.
Actually, a recent case is going on based on this also. Like
Yeah.
ORSL and
Yeah.
ESRL,
I've seen a
everything is there.
madam.
Like
Ma'am was. Yeah.
always I recommend powdered form of WHO recommended ORS, which is
Okay.
World Health Organization recommended ORS. And whenever you feel that whatever you are giving it right or wrong, always consult a pediatrician. Pediatrician knows the best. Always ask them whether this is the right ORS
Right,
to give.
ORS.
Always ask them.
Because
Never take chances in pediatrics.
because those ORS cartons come in handy. You can just buy it
Yeah,
for
yeah. Actually, they
100
have
and you
lots
can
of
just sip
sugar
it.
in that. Yeah, they have something called sucralose, which will increase the frequency of diarrhea, which will increase the intensity of diarrhea. They will not actually cure it.
Okay, okay. Those sucralose,
Yeah. So always
sugar
I recommend
agents.
WHO recommended ORS, oral rehydration solution. I will have to emphasize again and again. WHO ORS is always recommended, and
Yes.
zinc syrup is also recommended.
Okay, then. And I'm asking a serious question. Like one thing you want to tell to
Yeah.
parents, which they should fix immediately for their children's betterment.
Okay.
One thing they should fix.
Okay. Like don't believe in Google or ChatGPT by yourself. Whenever in doubt, consult a pediatrician, and don't take decision by yourself. Always pediatricians are there to help you out. So that's what I would like to say. And don't underemphasize anything, and don't overemphasize anything.
Okay.
Underemphasizing and overemphasizing depends upon pediatrician. Always he is the right one to decide.
Yeah, I think this overemphasizing part needs to be overemphasized
Yeah,
here because
definitely, definitely.
it's the thing you see regularly in OPD. Okay, that was very great time talking to you. It's
The
been
same
days
here.
we spoke for so
Yeah,
much
definitely.
because it was in our undergraduate we used to speak in person. Now it's after 3 years we've been meeting, and you're a pediatrician now, and you'll be
Mhm.
practicing in Delhi. And I'm so happy you had this time to share lot of
Thank
information.
you. I
It's a
actually
lot of
have my own
information.
YouTube channel, which is called Healing Hands by Dr. Adithya, where I
Okay,
solve lots of common queries, and I make videos on those.
awareness. Okay,
So
sure.
I request all the subscribers to see my videos also.
Yeah, I think I have subscribed it too because future I'll also
So
become a father. Yeah, the page is Healing Hands by Dr. Adithya, right? Healing Hands
yeah,
by Dr. Adithya. Okay.
Dr. Adithya.
You should visit the page, and you will find definitely useful information from the page, which might help you enrich your knowledge in parenting, in having a earlier treatment for your children. Do follow Healing Hands with Aditya. And if you like this video, please give us a like, share, and subscribe to this page so that we can bring more and more guests into this page and enrich your knowledge of yours and mine, because learning never ends, knowledge is
Definitely.
fast. See, today
Yeah.
I've learned many things from my friend Dr. Aditya. Yeah, I'm so happy, Aditya. Thanks for
Thank you. Thank you.
giving me your
Thank you so
valuable
much.
time. Sure, we'll
Thank
meet
you.
in the future in many more
Thank
podcasts.
you for the invite.
Yeah,
Definitely hope this thing helps the
patient.
parents, and it reaches the right population at the right time.
Yeah, definitely. We'll be getting more criticism for this video, but still, we took a
Yeah,
chance on
yeah,
educate the future
parents.
parents,
Yeah,
now parents, everyone.
yeah.
Thank you,
Definitely.
Aditya. We'll be seeing. Bye.
Thank you so much, Dr. Aditya.
Okay.
Bye.
Bye. Bye. Bye.